and I will introduce myself and all of the things. Okie doke. Yeah. I get really proud of myself when I make technology work. Okay. Good morning, everyone. Welcome. My name is Dolly England. My pronouns are she and her. And you are attending the COVID-19 Community Engagement Funding Announcement FAQ call. That's frequently asked questions. So we have gotten a lot of questions about this funding opportunity, and we want to try to answer those questions for you. So this webinar is really intended to discuss the Oregon Health Authority's funding opportunity for community-based organizations, or CBOs, throughout the state of Oregon. CBOs are central to the success of this work to integrate methods, tactics, and strategies that are most responsive to the needs of people of color, people with disabilities, immigrant and refugee communities, tribes, migrant and seasonal farm workers, and LGBTQI+ communities. CBOs have the opportunity to support 3 areas of work as part of our COVID-19 response. We are very excited to connect with organizations that are able to integrate methods, tactics, and strategies that are most responsive to the needs of people of color, people with disabilities, those that are houseless, individuals with substance use disorder, immigrant and refugee communities, faith communities, undocumented communities, and farm workers, people experiencing mental health, as well as older adults in the LGBTQI+ community. We need to do this in order to ensure that the success of community engagement, the contact tracing work, as well as social and wraparound supports. We have included a link to all of the application materials, and it is located on our website. This link can be found in a chat box. We have also included a link for closed captioning services in English. Please see the chat box to access closed captioning services for this call. As a reminder, we will be hosting an additional FAQ session. This is our last session in English. Our next session will take place on Thursday, June 18th from 11 to noon in Spanish. Please find additional information about these calls on our website, and that link is located in the chat box. Our agenda for today. I'd like to go over OHA's acknowledgement to community. We'll go thoroughly over the funding announcement, and then we'll open it up for question and answers. We acknowledge there are institutional, systemic, and structural barriers that perpetuate inequity that have silenced the voices of communities over time. We are committed to partnerships, co-creation, and co-ownership of solutions with communities disproportionately affected by health issues so that groups can actively participate in planning, implementing, and evaluating efforts to address the COVID-19 response and other health issues. We recognize community-engaged health improvement is a long-term and adapting process. We are striving to engage with communities through deliberate, structured, emerging, and best practice processes. We are striving to make engagement with public health effective for communities, especially those communities that experience institutional, systemic, and structural barriers. All right, so now I'm going to go ahead and get into the 3 areas of work. And CBOs have the opportunity to support 3 areas as part of the COVID-19 response: community engagement, education and outreach, contact tracing, social services, and wraparound supports. We will go into a little more detail now around the scope of work related to each of these areas. I want to remind folks that you can review the scope of work and all application materials on our website. Again, we've included that link in the chat box. Okay. Oops. Sorry, Kara, I'm having a hard time with the Zoom chat stuff, so if you could manage the volume for me, that would be great. Thank you. Okay, so this is going to be our social, I like somehow got really far ahead, didn't I? Let me go back here. All right, so let's get to community engagement, education, and outreach. So overall, this is the body of work, and this is what will be included. Educate community about safe practices to prevent the spread of COVID-19, answer questions, and act as a liaison between the community and public health. Regular coordination with local public health, or the LPHA, around where the community can access services like testing, healthcare, and social services. Inform the community about where to go for services like testing, healthcare, and social services. However, we are really curious to know how you would do outreach and education in your communities. You actually know them best. So what would you do to help educate your community around COVID-19? You could use things like newsletters, social media, group classes, emails, texting, or WhatsApp, or other methods for engagement. This may also include use of healthcare interpreters and existing language access contracts. Regular communication with community members in their primary or preferred language, including alternate format about COVID-19 and how to prevent the spread of disease. We encourage you to create and share culturally relevant information. You could also amplify OHA information by reposting social media posts or accessing resources like the Safe and Strong website. If this body of work is of interest to your CBO, we encourage you to apply. Transitioning into contact tracing, I want to recognize that this is a very high-level overview of contact tracing. We want to acknowledge your time and make sure we spend the majority of this call addressing all of your questions. So I will invite you to review the scope of work, which goes into detail around what is included in the work of contact tracing. As a reminder, a link to the application packet is located in the chat box. Part of Oregon's framework for opening Oregon is to actively suppress the transmission of SARS-CoV-2, the virus that causes COVID-19. To suppress disease transmission in the state of Oregon, it is critical to identify as many people who have been exposed to the virus as possible, and then conduct broad contact tracing to identify all contacts that may have been exposed to a case during their infectious period. Community health workers, traditional healthcare workers, and individuals who have similar training or skill sets are trusted community members who can effectively build relationships and make contact tracing successful. This scope of work involves closed captioning, close coordination with local public health, which will identify the contacts that need regular symptom monitoring and will communicate directly with CBOs doing the contact tracing work. OHA will support community-based organizations and LPHAs with delivering data sharing agreements to allow sharing of protected health information between organizations. OHA will also provide CBOs with contact tracing training and training on the area's contact tracing database. Contact tracers will utilize community health worker practices and methodology to establish trust with contacts, assess and collect important information required by OHA, and will follow scripts, policies, and procedures by OHA and comply with all state and federal HIPAA and other privacy confidentiality requirements and current investigative guidelines. Here are a few highlights of contact tracing work. Coordinate with the LPHA on contacts that need to be traced, calling all identified contacts of COVID-19 cases to document a system check, referring contacts for testing according to established protocols, provide contacts with quarantine instruction, and document work in the OHA ARIAS system. This is vital work, and we really need trusted members of communities to help us get the work done and to keep our communities safe and healthy. You all know your communities best, and we want to make sure that we are reaching all of Oregonians who may need isolation and quarantine. So if this body of work is of interest to your CBO, we encourage you to apply. All right, transitioning now into our wraparound supports. I again want to recognize that this is a very high level overview of the wraparound support services. And again, we want to acknowledge your time and make sure we spend the majority of this call addressing your questions. So folks who end up in isolation or quarantine because of COVID-19 are eligible to receive a number of support services to help them through this period of time. They will need lots of help accessing these resources, especially because they will need to be in isolation or quarantine. Isolation is defined as 10 days since the start of someone's symptoms through 3 days since the symptoms have resolved. Quarantine is defined as 14 days after exposure to someone, with individuals in isolation or quarantine and referring them to long-term resources that they may need. We know that for many of you, this is work that you are already doing, and that it's things that you're already helping your community with every day. Some of these things they may need help with may include, but are not limited to, the following. Healthcare, they might need, sorry, I keep having these pop up. Kara, can you let folks in from the waiting room or deal with the waiting room for me? Thank you. Okay, so they may need access to individuals and families around healthcare. So they might need to go to the doctor. You might need to help them make referrals, get appointments. They might need help grocery shopping, so gathering information for clients on their grocery needs, shopping and delivering food, or connecting with other organizations who can deploy volunteers to shop and deliver food. Housing supports could be identifying any housing needs and work with those individuals and families and the community organizations that may be around to help fill those needs. Utilities and other kind of communication supports, helping to identify those needs related to utilities, water, garbage, phone, internet, cable, and the work individuals and families and community organizations might need to access those benefit programs. Along those same lines, connecting folks to community resources. Some individuals may need more complex and ongoing case management services, and they may need to be connected to behavioral health resources, anti-discrimination resources, domestic violence, Department of Human Services. We don't know. And we need you to be prepared to help in any of these categories to help kind of navigate and fill that out. We recognize that some individuals will need more complex and long-term social service supports, and we want to work alongside you to help those individuals access more long-term supports via state and local safety net. So we actually are building that up on the back end so that we can create a path to help you access these services. The Oregon Health Authority is committed to engaging with community-based organizations and the communities they serve to ensure all members of our community receive information, services, and resources in the most responsible way. We know of the current fear and misinformation about the coronavirus within the community, and we like the opportunity to work alongside you to provide the public facts and support so they feel prepared to handle the coronavirus. So our process is as follows. We will select 120 community-based organizations. We will distribute across all 7 COVID-19 preparedness regions in the state. And we have $25 million for 6 months, plus reimbursements for isolation and quarantine related costs. In addition, we have a 1-year commitment from leadership for this work. So we have this really fancy funding formula based on equity and data that will help us distribute the funds across the 7 regions of the state. These estimated funds by region take into account not only population, but key demographics like diversity, languages spoken at home, and income level. We have a total of $25 million for the first 6 months of this work through December 30th, 2020, and a commitment to fund this work for a year. If available funds for the second 6 months are not available at the same funding level, OHA will adjust the scope of work and CBOs may end the grant agreement. OHA will pay CBOs for the first 3 months of work and their startup costs up front at the time of their grant agreement is signed. The next 3 months will be paid upfront in September, and amounts may be adjusted based on needs and COVID-19 cases. We have already started to receive many questions around who is eligible for this work. So here are your eligibility requirements. Any 501(c) organization that provides culturally responsive services to communities in Oregon that are disproportionately impacted by COVID-19. Organizations with a 501(c)(3) fiscal sponsor are eligible to apply. Organizations must hold commercial general liability insurance covering bodily injury and property damage of not less than $1 million per occurrence, an annual aggregate limit not less than $2 million. If you are not a 501(c) organization, but you are interested in doing this work, we encourage you to seek a fiscal sponsor. Someone who is a 501(c)(3 that might be able to fiscally sponsor your work. We are very open to working with new partners and encourage you to think about how you can work with other organizations to get this work done and keep Oregonians safe and healthy. Oops. Okay, so I want to talk a little bit about eligibility. All grantees must abide by OHA's discrimination policy and state and federal civil rights laws unless otherwise exempted by federal or state law. Health systems are not, and not for, excuse me, health systems and for-profit organizations are not eligible. Specifically, people participating in OHA-sponsored activities or programs may not be treated unfairly because of age, color, disability, gender, identity, marital status, national origin, race, religion, sex, or sexual orientation. We are truly sorry for the inconvenience, but health systems and for-profit organizations are not eligible for this funding. All right, so for our funding, we have, if I can ask everybody to please mute your phones, mute yourselves. Estimated available funding for initial 6 months, $25 million. The second 6 months of funding will be determined based on available funds. Funding will continue for core staff support and deliverables will be adjusted based on total available funds in the course of the COVID-19 response. So it is our goal to fund 120 grants statewide. All right, so for funding, we have a number of ranges, and these are based on individuals served. Below here is listed the ranges and your options. So for community engagement, you can go anywhere between $11,783 to $47,131. Contact tracing, $6,546 to $26,184. Social services and wraparound supports, $7,855 to $31,421. One-time funding, we will give everybody startup costs, one-time funding amount of $5,265, and these funds can be used to purchase equipment for employees or any startup cost to implement this new work. If a CBO covers multiple regions or works statewide, Please note this in your application. Again, I'm going to say this again. If a CBO covers multiple regions or works statewide, please note this in your application, as your proposed budget may be adjusted to accommodate number of people proposed to be served. We want to be very clear when we talk about all of this money that we will have a separate reimbursement process to cover direct costs related to an individual's isolation and quarantine. So CBOs can submit direct costs related to isolation and quarantine. So remember, at the beginning of the call, we talked about that isolation and quarantine period. We have a separate reimbursement process if somebody needs access to housing or food. You could submit those direct costs related to isolation and quarantine to us, and we will reimburse you for those. I'd like to note that those reimbursements do not include things like car payment, credit card payment, or student or personal loans. We are working really hard to eliminate any potential barriers that an individual may face in isolation and quarantine. So CBOs will be allowed to submit direct costs for reimbursement. Here is our application process and timeline. You can submit questions or completed applications to our website, which is listed there. As a reminder, we have included a link to the application materials in the chat box, and we are working really hard to recruit CBOs, get the money out, and start providing this important information, resources, and services to some of our most underserved communities, and not only underserved, but hardest hit. So that is why we are moving quickly. Please get your applications in by June 24th. I have already had a number of people ask, is it due on June 24th? The answer is yes, please submit your application by June 24th. What will happen is if we decide we didn't get enough applications, we will keep it open in the regions where we need to see additional support. But I encourage everyone to submit your applications by June 24th. So in order for you to really get who we're trying to serve, I created this specific slide. So who we as the state are trying to reach are people of color, people with disabilities, people who are houseless, individuals with substance use disorder, immigrant and refugee communities, faith communities, undocumented communities, farm workers, people experiencing mental health issues, older adults, and LGBTQ plus communities. So we're trying to reach a lot of different types of people. If your organization serves any of these groups of people, then we encourage you to apply. In order to ensure the success of this community engagement work of contact tracing and social services and wraparounds, we have to make sure that we're reaching everybody. And we need your help to do that. So at this time, we will try to address all of your questions. Please feel free to enter them into the questions box, into the chat box at this time. We will do our best to read and address those questions. If we don't know the answer to your question, we will get the answer to your question. We have been working on an FAQ, and after this call, we will be posting said FAQ to our website. So continue to check out our website to get the answers to your questions. Okay, we appreciate your patience. Kara, I am gonna let you run the question show because you're real good at it.
Hey, thanks everybody. So let me pull up the questions. We're gonna try to get through all of them in the 33 minutes we have remaining. I also wanted to share that we're going to be posting a written FAQ document to respond to the questions that we received by email, phone call, and at our first session that was on Monday, and we'll just keep adding to that. So let's see here. Let me go back up to my questions. I just wanted to point out again that in the very top of the chat box, Dolly included a link to where the funding opportunity and the grant application are posted. That's also where you'll find FAQs when we post those, as well as other documents, a recording from the Q&A session on Monday and so on. So we'll be putting the recording from today there as well. Okay, getting to questions. It seems like the magnitude of the need for the first three tasks, education and outreach, is not necessarily based on the number of COVID cases in the community, but the other two are based on actual incidents. Is that an accurate summary? Yes, Howard, I would say so. We recognize that you're going to need to connect and do engagement with your community, and the number of people that you'd be reaching there is very broad potentially. And it is difficult to anticipate the number of individuals your organization may serve with contact tracing or social services and wraparound supports, because that will be dependent on the number of cases in your service area. And so really what we're asking for in the application are some estimates for any of the areas that you wish to apply to, about how many people you think you could serve. Again, recognizing we don't know for sure what the demand or need may be for contact tracing and social services and wraparound supports. This is why for the funding, we're providing 3 months of funding upfront for the grantees, and then we'll be able to look again and adjust those figures based on need for the second 3 months. Regarding contact tracing, are those names OHA will share with us to be contacted, or are they names within our specific community that we will connect with? So I want to also draw your attention here on this particular piece related to contact tracing. There's a brief PowerPoint included on the Funding Opportunity website. It is called, let me look it up, CBOs and contact tracing. So in the links there in the yellow box, it's a PowerPoint that really walks through and explains how case investigation and contact tracing work. And so for this, essentially what occurs is the local public health authority where you are working receives information on a positive case. They would then conduct the interview with the case to identify in part any individuals that they may have had exposure with in the time that they were symptomatic. And then the local public health authority will be working closely with the community-based organizations in their jurisdiction to help do contact tracing for those individual CBOs that have applied and received funding for contact tracing. So we're going to need to be working very closely with you to develop some agreements to share protected health information between local public health and the CBOs that are doing contact tracing. And that will help you know if you're doing that work, who to follow up with and what the procedures will be. If an organization is receiving funding from the local public health authority for similar work, would they still be eligible? Yes, potentially. What we have asked you in your application is to identify what the work is that you're already doing with local public health. We've had the opportunity to go above and beyond if there are areas of work that you're not currently funded for by local public health. So I recognize that may be different based on where you're located and what type of work you may already be engaged in with your local public health authority. My organization is a 501c3, but also a healthcare system with a community health worker program. So we wouldn't be eligible. I think that there's a later question here that I'm going to answer these two together. What's a health system? Does that include community and migrant health centers? So community and migrant health centers, community health centers are eligible to apply. Hospitals, health plans, coordinated care organizations are not eligible to apply. Really for those community and migrant health centers, what we're looking for again is the ability to engage community and really reflect community need in this work. We had another question, what cost per participant are those numbers based on? Essentially what we did in terms of providing you with a sample range to look at are in terms of the overall funding that we had available, breaking that out We looked at about what amount of time you might be spending across those 3 activities, and that's where we came up with the example ranges. That's designed to be a guide for you, just in terms of knowing around where to request for each of the 3 areas. Are the social services or wraparound supports specifically for individuals who are formally quarantining or isolating, or would services for individuals who are more generally impacted by COVID, are they also eligible? So the funding, the direct reimbursement that we would provide for social services and wraparound supports are indeed only for individuals who are formally isolating or quarantining. We would expect that as a part of that social service and wraparound support body of work that's included in the scope of work, part of it will involve referral and connection to longer term social services, again, for people to be able to follow stay-at-home orders or coping with layoffs or lost wages. There are other funding streams, and this is to Dolly's point earlier, that are going out in the community and in our state that we at OHA will be helping to catalog and make quick connection and support to, so that all the CBOs that we're funding with this grant opportunity can access those programs quickly and be able to do that longer term social service referral and support. Let's see. Similar to the previous question, for social services and wraparound supports, how are individuals connected with CBOs to ensure that CBOs serve individuals within their community? I think I might need some additional context around this question. So if you don't mind typing that into the chat box, I'll come back.
And I'll come in and try to help too. And I'm thinking, if you mean this person is Spanish speaking and we need to connect them with services that are in Spanish, then we would be able, through the contact tracing process, one of the questions we ask is what language, because we need to make sure we then are connecting them with a Spanish speaker, right? And that through that process, we would learn which CBO would be best suited for that particular individual. So that's part of how we will kind of assign the case, if you will. So I hope that that helps a little bit with that question.
Thanks, Dolly. And I'm sorry, I have the chat box open wide on my screen so I can see everything. So I'm not following. Just chime in and interrupt me, Dolly, if I'm missing anything.
It's cool. I'm good at that.
Okay, so how does a CBO know how much contact tracing is needed and how much to request? Again, we're not able to project this at this point in time. So what we're asking for this application is just an estimate of the amount of hours monthly or so forth that you'd be able to spend on contact tracing, so that we do have the capacity ready in the community if we need it. And then if we need to make adjustments down the road, we'll do that at the 3-month mark. Are quarantine-related reimbursements separate and apart from the grant funding request? Correct. That's a different amount of money that is set aside directly for reimbursement for isolation and quarantine-related costs, and you do not need to include that in your budget projections as a part of the application. Can training for healthcare workers to better serve specific populations be funded through this process? No, these funds are really specific to the scope of work that's included on our website. So again, we're looking at community engagement, we're looking at contact tracing and social service and wraparound support specifically for individuals that are impacted by isolation and quarantine related needs. Certainly, again, community engagement is a part of this, this funded body of work. Can an organization participate both as being funded and as a fiscal sponsor? I think this question is if you were directly doing the work and you were also being the fiscal sponsor for another organization. I think so, and we might want to talk a little bit more about organizationally what that looks like and if that might just be one potential application. We had a question on our last call about whether organizations could apply together, and we said absolutely. So that might be something you want to consider. Can we discuss reporting expectations? I'm going to have Dolly, you start with that one, and then I think I do have an answer on the Real D part of the question.
Okay, so we have created a reporting form, and it is real simple because what we heard from community is we need you to keep it simple. So we will be collecting information on the 3 bodies of work: outreach and education, the contact tracing, as well as the wraparound and support services. For outreach and education, we're asking you, like, what did you do? What kinds of resources did you use? Who did you talk to? Tell us about some of those conversations. We're interested in, like, the number of touches as well. Like, how many times did someone, if you're doing social media, click on your link or whatever? That's easy data to collect. So, and then what else? For contact tracing, I will tell you this will be the more complicated. You will need to do daily reporting through the ARIAS system as part of that contact tracing work. We will have a section on our reporting form where we ask how that's going, how many people did you connect with, that kind of a thing. And then for the social and wraparound supports, we will again ask, how many people did you reach out to? What type of resources did you connect them to? What kind of barriers did you face? We will be collecting this information via an electronic reporting form per the request of community. We heard this was the best way to do it. We are also looking at doing some audio reporting options for communities that have other accessibility needs. And then lastly, this report will be due quarterly. We will ask for a quarterly report.
Great. And then I just want to respond to the Real D question. In terms of the area system for contact tracing, we will be adding Real D data collection into the system, and we're working with our developers to get that added into the system right now. So that will be coming down the road. Our organization is not a health-based organization. Will OHA be supplying information or materials we need in order to do?
Yep. We got so many. I got videos, I got Facebook, Instagram, what you want, we got it.
Thanks. Cities would not qualify, correct? And we would need to work with a 501c3. Yes. 501c3s and 501c3 fiscal sponsors are eligible to apply. Are the funding amounts showed for 3 months, 6 months, or 1 year? Those are 3-month estimates. And you'll also see on our website a simple table that shows for each of the areas proposed ranges based on the number of people you're proposing to serve. Will you provide training to community health workers on how to keep themselves safe from contracting COVID-19?
Yes, we have an amazing onboarding training that we are creating. We also have access to guidance from senior health advisors who are providers working the COVID-19 response alongside us. So we will make sure everyone has the information and resources to be safe doing this work.
Can you apply for 2 areas? Yes, CBOs can apply for 1, 2, or 3 of the areas included in the scope of work. Given how many deaths to COVID-19 have been among older adults, would you consider them as a standalone category for people served?
Sure. I mean, I would like to know what kind of old people are you working with, right? I still want more information, but you're right. They are, and older adults are in our list of people that we're interested in working with. I need to know how you're doing that work, though.
So there's a question about contact tracing and is it up to the discretion of the state to decide whether or not someone may isolate or quarantine. So in the contact tracing work, essentially, again, the local public health authority receives the information on a positive COVID-19 case in their jurisdiction, and they conduct the case interview to identify any individuals that have been exposed. They'll then make the first contact to those individuals and recommend that they quarantine for 14 days and identify some other things that will help you all know and help the local public health authority know which CBO, if they have CBOs doing contact tracing in their jurisdiction, would be most appropriate to do the daily follow-up with that individual. And it's part of the role of the contact tracer to continue to help support an individual who is in quarantine or isolation, and specifically in identifying if they have any barriers to be able to help meet those. So if they need meals delivered, if they need help with accessing medical supplies or things that they might need to conduct symptom monitoring and so forth, that would be the role. And then if there were other issues there that are identified through the process, and we would work with local public health to consider other measures to help support spread of COVID-19 in the community, or preventing the spread of COVID-19 in the community.
I'm noticing our time, so I want to quickly answer a few of these questions that I see. Chelsea, you found my mistake. It is both older adults and LGBTQ plus communities. Carl, you asked, the RFP mentions bilingual CHWs. Is it okay if the CHW only speaks Spanish? Yep. In fact, I need you to just mention that on your application that you have monolingual staff, because that helps me understand the support that we need to give you from the OHA side. Someone asked about the link. It's at the top, the very top of the chat box. Maria Park, how's it going? I see Chuck Smith too. Yeah, Chuck. How much tracking reporting will be expected, and will it be monthly, quarterly at the end? I think we answered that one. Quarterly. I kind of went over that. Kara, if I skipped a few budget ones in between. I don't know if we kind of answered those ones.
I think that propose a 6-month budget in the application. We're asking you to propose the 3-month budget to start. I think that's one we hadn't answered yet.
Would hiring a CHW to do the outreach and healthcare piece be an appropriate use of these funds? Heck yeah. If so, are most local health departments a willing partner in this? Well, let me just tell you, first of all, we know we don't have enough people to do this work. And I think you all need to think about this as a capacity building opportunity. How would you build, staff a team to help do this work? So absolutely think of it as that. The second piece of this is that LPHAs are a critical part in this. And the way that we have this structured right now is that we are building a team. If those of you are familiar with the Community Partner Outreach Program or the CPOP team, they do the OHP enrollment work. We're building that same structure within the Public Health Division to respond to COVID. So each community-based organization will be assigned an OHA staff person to be their liaison. That liaison will work with you to navigate all of the things that may come up, including working with public health. But public health will be a very important partner, especially for those doing contact tracing work. That is where you get your contact tracing information. That is why we have an MOU around data sharing, because you're going to be sharing information around contacts. And you need to report back to public health what you find out from those contacts, right? So it's very important. And so yes, they're going to be a willing partner, and we're going to help build the bridge, because we need to make this work. We need to help keep our community safe. I'm off my soapbox.
Okay. I'm trying to go back to where you may have left off. Do you have an hour time frame that you had where you had been leaving off, Dolly, and I can pick back
I
up?
am still at 10:30, so I just want to acknowledge that there are 36 new messages in my chat box, and we are clearly not going to get to all your questions in the next 12 minutes, 13 minutes.
Mm-hmm.
So I want to promise you that keep putting your questions in the chat box. We're going to keep reading them. We will upload an FAQ with answers to all of these questions. I want to also remind you that on the website is the email address for the community engagement email box. We are checking those emails regularly. If we truly don't get to your question, you need it answered immediately, email us. We'll do our best to get back to you. Okay. Regarding contact tracing, I have read an OHA website that isolation and quarantine is voluntary and not.
I think I answered that one.
Okay, cool.
Okay, public health entities eligible for this funding. Local public health authorities have already received separate funds for contact tracing and case investigation and funding to help work with the CBOs in their jurisdiction. So if it's a governmental public health authority or a tribal public health authority, there are separate resources for that. There's a question about single community organization or one that serves multiple communities or statewide. I think this is why we provided some suggested ranges. If you're working statewide, I think you need to look at how many people you're able to serve and then adjust your proposal in terms of what resources you may need up to that. So taking a look at the suggested ranges and then going beyond if you're going to be serving well over the recommended ranges.
Are agencies required to have CHWs and HCIs, healthcare interpreters, in order to provide social wraparound supports? No. But we like that model. I think you said social workers. That's a great model, and that also makes very much sense.
Again, I'm sort of trying to scan here and find things that I haven't, Dolly, have not already answered. So how are people connected to CBOs that are providing social services and wraparound supports? Yes, so if you are just providing social services and wraparound supports and not doing contact tracing, then that referral would come from the local public health authority. Are there character or word limits on the application or page limits? No.
Something about subcontract, can we enter and have a subcontract with a second CBO? Sure.
Yes. Grant funds for the first 3 months will be provided. You can invoice for us or for that full amount right away, and then we will look again at your spending and reach and where we're at in terms of the state's cases for the second quarter.
Veronica, yes, OHA will be providing training for CHWs on COVID, contact tracing, all of the things. You do not have to create all the materials. We will do all of that. And yes, this is being recorded and all of this will be put up on the website. The slides are already there. The FAQs will be up shortly. You're going to get some upfront money. Will the grant funds come out at once or will it be reimbursed quarterly? You're going to get some upfront money and then we'll give you money quarterly. Then we'll relook at that for the second quarter, right? Based on need and cases and all that jazz.
Yep, and then with the reimbursements for any isolation and quarantine related direct costs coming, you can do that monthly or quarterly, depending on what you'd like to do as an organization.
Heather, to start, how can CBOs let non-501c3 entities know that they may contact to act as a fiscal sponsor? Heather, to start, I don't know what org you're with, but go ahead and put your email in the chat box for anybody on here that's looking for a fiscal sponsor. That's how we start that chain.
So there's a question around whether these funds can be used for self-isolation because of high risk. Somebody who would be in isolation is someone who has tested positive for COVID, in which case, absolutely yes, as well as the direct wraparound social service costs reimbursement. If there's another community member who is staying home because they are high risk, then those direct costs would not apply to that individual. Those are only for isolation and quarantine. That doesn't mean that you wouldn't necessarily be able to reach individuals who are high risk through the community engagement portion of this.
Okay, Michelle says we use peer support specialists instead of CHWs. So could these funds help support PSS doing the social services work? Absolutely. Is the application similar to procurement site? Nope. We don't have it on the procurement site, do we? We took all of that out. You just email your application to us. That's the application process. Also, the 7 regions. I'm going to address how did we get these 7 regions. The 7 regions are based on the Oregon Emergency Preparedness Map that we are following as part of Incident Command. I see a lot of questions about voluntary versus involuntary contact tracing isolation, and this is a really specific question that goes in a lot of different directions, and I'm going to summarize it by saying, you're right, it is voluntary. We will encourage people that have tested positive to isolate or quarantine if possible. And we will also encourage folks that have been exposed to isolate. And that's going to be part of our work as a community, is to educate them on to why that's important. And so there will be people who don't want to. We can't make anybody do anything. I just want to say that right now. We just can't. So let's set some expectations here as we think about that. But our goal is to help keep our community safe. So that means we're going to need to do some education with those individuals around why they need to be in isolation or quarantine. So I hope that that addresses like roughly a lot of questions that I'm seeing specifically on that topic.
Okay, so there's a good question around hiring new staff. So in terms of the budget for every 3 months, so we will be paying you upfront for the first 3 months, and then we are committed to keeping staff going for the second 3 months. We may need to adjust in terms of some of the social service or contact tracing amounts if that's what your CBO is doing, really based on the number of the need that's in the community and the number of people served. So if we have, for example, a large surge in one area, we want to make sure that that jurisdiction is well supported in terms of contact tracers. The 6 months, we are working diligently to identify the full funding. The initial funding that we're using for this work does end at the end of December. And we do have funding, we know, for contact tracing into 2021, and we are working on the rest.
I want to address this contact tracing question. We really need to know about family quarantine, especially infant mother contact tracing question. If a family living in close proximity in a single household or are identified as a recent contact of an individual who has tested COVID-19 positive, will the members of the contact family be required to quarantine separately if they all have exposure together to infected cases? Will the family who is exposed together be permitted to quarantine together? So these are very specific questions, and the answer is we are going to do our best to keep that family together when it's safe, period. And again, these are very specific situations, but this is why each community-based organization doing the contact tracing work will have a community engagement coordinator from the state that is their liaison. So we can help sit and figure out all the things that need to happen for that specific family, because every family is going to have a different need. And what our goal is to eliminate barriers for people. This is going to suck already that they have to go into quarantine and isolation. And we need to do our best to eliminate as many of the barriers as possible. Finding housing or a hotel room or whatever for someone that needs to go into isolation or quarantine is kind of a simple task for us at this point. So I hope that answers that very bleh, complex question. Okay, we have 3 minutes. Let's get it.
Someone's asking where they send their application, and you would fill out the application form and yes, email it to community.covid19@dhsoha.state.or.us. Okay.
Can funds be used to support the administrative costs like for a CFO?
There is an indirect cost applied, so you can include indirect costs. If you have a CFO who is helping to support the work, for example, doing your invoices for isolation and quarantine costs, then you may also list them as a funded personnel with a percentage of their time being spent to this. Does the sponsor need to be in the same service area as the one doing the work? I don't necessarily think so, but I think we would want to be sure that the fiscal sponsor in some way has a sufficient connection and oversight to the work being done.
I work for a DV and SA agency, and we are interested in providing training for CBOs provided in all 3 focus areas. Would this be fundable? I don't think so. We really need folks to focus on our 3 bodies of work. We need folks to do outreach and education specific to COVID to community. So if you were doing outreach and education to your specific communities, then that might work. But we, at this time, that's what our focus is for those 3 bodies of work. And we're gonna run out of time, and I want to acknowledge that we still have 9 questions. Some of them are just thank you. You're welcome. Great information. Thank you. I really tried really hard to make sure it was awesome for you. I'm not gonna lie. We are here. I think someone asked about the email. It's on the website. Somebody else put the link to the website in there. We are here. Email us. We're doing our best to make this as accessible as possible for you. So we appreciate you taking an hour out to hang with us. Thanks for those clapping hands. I appreciate it. All right, everyone, have a fabulous day. We hope to see your applications. Bye-bye.
Thanks.